there, I'm Tiffany Smith, and you're listening to Let's Talk About It. We're talking about some of the most important health questions that are on young ladies' minds, and today we're lucky enough to have Dr. Lauren Streicher here with us. She's a gynecologist and an expert in this field. Thank you so much for being here today.
Thanks, Tiffany. I'm really glad to be here.
You know, I stopped out on the streets of New York to find out what was on some young women's minds, and they had some really great questions for you. Let's take a look.
Okay.
I'm here with Courtney, and she has a question about pregnancy tests.
I do. Are pregnancy tests really reliable? I had a friend who took one and it came out negative, but it turned out she was pregnant.
Well, let's see what Dr. Streicher has to say.
Well, actually, home pregnancy tests are reliable if they're done correctly. You can run to the drugstore, pay $20, and do a home pregnancy test that's incredibly reliable. Even if you flunked high school chemistry, this is something that's pretty simple to do. Having said that, they're not always 100% accurate. If the results aren't what you expect them to be, go see your gynecologist, get a confirmatory blood test, find out what's going on.
Now, what if you're in a relationship and your boyfriend doesn't want to use a condom?
Yeah, that happens more often than you would think. And the problem is that if he doesn't use a condom, you need to accept the fact that you're putting yourself at risk for a sexually transmitted infection. Because even if he says he's been screened, the truth of the matter is that men can't get screened for everything. For example, there's no way to screen men for HPV, and he may not know that he has it. So if you don't use a condom, you may end up with an infection that could have consequences for you.
To protect yourself, how often should you and your boyfriend be getting tested for STDs?
Well, I think the best thing to do is ideally you should both be tested prior to becoming sexually active. Once you are sexually active, whenever there's a cause for concern, whether you think maybe someone wasn't monogamous, or if you have a funny bump or a rash, that would be a reason to go in and get additional testing.
Better safe than sorry, right?
Always, always.
Well, thank you so much for being here with us, Dr. Streicher. I'm Tiffany Smith, and that's it for this episode of Let's Talk About It. I'll be back with even more stuff that's on my mind next time.